What's up, friends, and welcome back to the channel. My name is Nico. I'm a registered nurse out of North Carolina, and I work in the ICU. And in this video, I'm going to show you a little bit about how to do a detailed head-to-toe assessment on my patient, Mrs. Brown here. So a couple supplies that you're going to need. You're going to need your stethoscope. You're also going to need a pen light. And then I would recommend, I'm going to go ahead and get a set of vitals in the video here just to kind of show you how to do that. And I think it's important to have a set of vitals before you do an assessment. All right. So I'm going to leave and then I'm going to come back, okay? I'm going to knock. Good morning, Mrs. Brown. My name is Nico. I'm going to be your nurse today. How are you feeling?
Quite well, thank you.
Perfect. And before we begin, can you please tell me your name and date of birth?
Linnell Brown, March 17th, 1932.
Perfect, thank you for that. And if it's okay with you, I'm going to go ahead and get a set of vitals and do a nursing assessment. Is that okay?
Yes.
Perfect. So before I begin, I'm going to go ahead and perform hand hygiene, and then I'm also going to put a pair of gloves on as well.
Okay.
All right, perfect. So I just performed hand hygiene. Now I'm going to put a pair of gloves on and get a set of vitals from you, if that's okay with you.
Okay.
All right, so the first thing I'm going to do is get a blood pressure. And then this is a temple thermometer here. Just take your temp. Perfect, 96.5. And then this is a pulse ox sensor here, just a portable, but in the hospital or the clinic you might have one attached to the Philips monitor. I'm gonna go ahead and pop this on your finger there, okay? And you can relax that. Perfect. All right, perfect, 98%, looks good. It's just reading your blood pressure now.
Okay.
So while that's reading, I'm going to start, obviously, we're going to do a full head-to-toe assessment. We're going to start neurologically and then kind of work our way down. And I'm going to ask you some orientation questions. So you already verbalized your name and date of birth to me. Can you tell me what year it is?
2019.
That's okay, close. It's 2023.
Oh.
That's no problem. And then for situation, I typically like to ask patients a little bit like of an open-ended question like, can you tell me a little bit about what brought you into the hospital or the clinic? She might say something like, oh, I was having some nausea, vomiting, or I was having some chest pain. That would be an understandable answer, and that would be that would tell me that she's oriented. On the contrary, I've had patients tell me before, I'm not in the hospital, or I'm at home, I'm at the library, or they might just say, I don't even know why I got brought into the hospital, or they might even try to kind of defer the question. That might be a sign or symptom that they are not oriented to situation. So I would say, honestly, Lynn, you are alert and oriented times 3, okay?
Okay.
So once we finish with that, I'm going to go ahead and start with a pupil assessment. I can take this off you, my dear. Perfect, thank you for that. So first and foremost, obviously we're just going to kind of inspect her face and make sure everything looks okay. It looks very, very symmetrical. Very important. I don't see any sort of like facial droop or any sign, symptom of stroke. That's very, very important. Her eyes look pretty good. Pupils look okay, but I'm going to verify that. Ears look good. Hair looks good. Checking for any type of wound or anything like that. I can also step to this side and have them turn their neck this way and cough for me. I'm just assessing any JVD right here. I don't see any, so that's a good sign as well. And Mrs. Brown, could you please remove your glasses for me? I'm just going to shine a bright light in your eye, okay?
Okay.
Open. Perfect. And then open. Perfect, good. So when you're assessing pupils, you want to follow a assessment tool known as the PERL tool. That's PERRL. Pupils are equal, round, reactive to light. So I would classify her pupils as they're brisk, they're round, reactive, and they're a size 4. So that's how I would classify that, which is a normal assessment finding. If one pupil was bigger than the other, or one pupil was not reactive, or they were sluggish, that would be an abnormal assessment finding, okay? For neurologically, also, you can go ahead and assess bilateral sensation. That's a very, very important thing as well. So can you close your eyes for me, Lynn? And I'm just gonna tap your face here and touch here. What side of your face am I touching?
Left.
Perfect. And what about on this side?
Right.
Okay. And this side?
Right.
Perfect. So she answered all those appropriately, meaning telling me that she has good facial sensation. She knows what is going on there. So now you can go ahead and squeeze my hand here. Give me a hard squeeze. Good. And then on this side, perfect. So she has +5 strength bilaterally there. And then also we're going to go ahead and dive into the feet. Can you push up for me? And then on this side, and then push down and down. Good. Excellent. So she also has normal strength in her lower extremities there as well. So that's all normal assessment findings. So that's pretty much it with neurological. Now we're going to move into respiratory, okay? So I'm going to go ahead and get my stethoscope here. So if it's okay with you, Lynn, I'm just going to listen to your lungs, okay? Obviously, you're going to want to assess if this patient is on any oxygen. Sometimes I even ask patients, typically at home, are you on any oxygen?
No.
Okay, perfect. Some patients will tell you, yes, I'm on 2 liters at home, or yes, I have asthma, or I take an inhaler, anything like that, Mrs. Brown?
No.
Okay. All right, so first I'm going to listen on the front here. Deep breath. Good. One more. Perfect. And sit forward for me. Deep breath. Deep breath. Deep breath. Good. And last one. Perfect. Cool. So your lungs, Miss Brown, actually sound pretty clear. They sound good. This is where you would obviously assess for any sort of crackles or wheezes, any adventitious lung sounds, rhonchi. If they were coarse, if they were diminished, that might be a sign or symptom of like a pneumonia or an exacerbation of heart failure or COPD or something like that. She's not having any respiratory symptoms, and then obviously per the assessment, her lungs are clear, which is a good normal finding. So next we're going to move on into the cardiac system. So I am going to go ahead and just listen to your heart, okay?
Okay.
Perfect. And while I'm there, I'm going to actually take both your hands as well and feel your radial pulses here. Check for a good perfusion. Good bilateral +2 on both of those are palpable pulses, which is a normal finding. Your heart sounds good. I was able to auscultate normal S1, S2. I didn't hear any murmur or gallop or pleural flexion rub or anything like that. So she has normal heart sounds. That just takes time to kind of assess that and any adventitious sounds there. That's going to take some assessment practice. But if you hear something, it's very important that you note that to the physician, or you can even grab another nurse or another provider to take a listen. If you felt like you heard something, it's totally fine. I didn't hear anything, so that's a normal finding there. You can also grab her finger and check for good cap refill. That's where you squeeze down the nail bed and see how long it takes for that blood flow to return. Hers is about 1 second. Anything less than about 3 seconds is going to be a normal finding. Let's check this one. Perfect. So those are normal as well. Including cardiac assessment, also you can check for any type of edema in the upper extremities and as well as in the lower extremities. any pitting edema or anything like that. I didn't assess any in her, which is good. That means she doesn't have any fluid overload currently. So that's a normal finding there, okay? Are you developing any shortness of breath or chest pain?
No.
Okay, perfect. What about any pain in general?
No.
Okay, perfect. How would you rate your pain on a 0 to 10? You told me no pain. Would you say about a 0? Okay, perfect. So that completes the cardiac assessment. We're now going to move into the GIGU, that's genitourinary and gastrointestinal. So we'll start with the gastrointestinal system first, and I like to ask open-ended questions like, are you having any signs and symptoms of diarrhea?
No.
What about constipation? Any stomach pain?
No.
Any bloating?
No.
Okay. And then what we would do here is just, if it's okay with you, that I take a look at your stomach? Okay. Bloating or any bruising, or if it's tender or anything like that? Anything there, Mrs. Brown?
No.
Okay. Perfect. So now I'm going to go ahead and actually auscultate your bowel sounds and make sure you have normal bowel sounds. Check all 4 quadrants. Deep breath. And relax. Good. Perfect. You have good bowel sounds. They're classified as active. You can have a patient who has either active, hyperactive, or hypoactive. In this case, hers are active, so that's good news. You also want to ask the patient, when was the last time that they had a bowel movement, just to kind of assess to see, do we need to start this patient on like a stool softener, or vice versa, if they've been having a lot of bowel movements, maybe we need to give them something to help control that while they're in the hospital. So that kind of completes the GI assessment. Moving on to GU, this is where in ICU oftentimes you'll have a patient that has like a Foley catheter or PreAssessment or something like that, some type of urinary device. This is where you would assess that device, make sure it's functioning properly, make sure it's nice and clean, dry, and intact, as well as measure the urine output that the patient's having. Typically it would be around every 2 to 4 hours you're going to measure that output. And then, every hour, if it's not at least 30 mLs, that's going to be a sign that those kidneys are not working properly. In this situation here, we have a patient who's pretty ambulatory, doesn't need any type of urinary assistance. So what you would want to do is, if she were to go to the bathroom, you might want to catch it in the hat and assess the quality of it. Make sure it is yellow, straw, and the amount, just to kind of make sure that she is producing adequate urine. And you can also ask open-ended questions. Miss Lynn, do you feel like you have been using the bathroom appropriately?
Yes.
Okay, and have you noticed any, blood or anything like that in your urine?
No.
Okay, perfect. So that, again, is very important assessment findings. Moving on, so now what we can do, obviously, we essentially have finished a good head-to-toe assessment there. Now what we would do is move on into assessing the lines, drains, and airways. So I just have like a little flush here just to practice with, in the chance that the patient would have like an IV here. You could assess the IV if they had one like in the AC or in the forearm or something like that. You would clean off the catheter really good, 15 seconds with alcohol. Make sure there's no medication instilled in it, like a heparin or anything, or any IV line infusing continuously. If there's not, you would go ahead and give it like maybe a little flush and check back, pull back a little bit and check for blood return patency, and then make sure the IV is in the right spot. You want to assess the site very closely while you're flushing with maybe 3 to 5 ml of saline. Assess that site and see if it bubbles up or see if it causes the patient pain. That might be a sign that it's infiltrated or it's not in the right spot. If you aspirate or pull back on the IV and it has blood return, that's pretty much confirmatory that you're in the vein, you're in the right spot. Same thing if they had like a central line up here. Some patients are going to have like a right IJ triple lumen central lines where you would essentially do the same thing. A little bit more important on these, you obviously want to make sure that the site looks clean, dry, and intact. or that you obviously want to make sure there's no heparin in that line. Sometimes they will heparin lock those catheters. So before you flush anything or check it, you want to make sure, check the chart, but also check here. They should have a sticker that says that this line is heparin locked. So that kind of completes, I would say, kind of the IV assessment. You also want to, while we're on this topic of lines, drains, airways, some patients might have like a JP drain or chest tube or something like that. This would be a good time to kind of assess the externals. Check to see, does the patient have any drain? Did they have any surgery recently? Did they have any chest tube placement? Obviously on this patient they do not, so that is okay. Does this patient have any airway? No, they do not. They have a natural airway, but this is where you would assess the endotracheal tube or the, if they have like a BiPAP or CPAP or something like that, or nasal cannula, that's where you would assess that. But this patient's pretty unremarkable, which is a good thing. How old are you, by the way, dear? 91, I think. So yeah, that's goals right there. But as we're kind of working our way down, that would be kind of like the last assessment piece, would be those lines, drains, airways. And then the last piece is that we like to talk about kind of plan of care or plan for the day. So in this particular circumstance, it definitely is very patient specific, depends on the patient. I would say if Miss Brown got transferred to us in the hospital, a plan for her would be to ambulate safely with the nurse or with PTOT because she can, assess her mobility. We would also maybe want to assess her for a diet, make sure that she's safe to eat and drink, make sure she's safe to swallow. We would also want to collaborate with the physician and some other, partners within the healthcare team to see what's the plan for this patient. What medications do we need to start on this patient? Is she having any type of fever or pain that we need to address going forward? And really that's about it. Just kind of touching base with the patient, first with the vitals, next with the assessment, and third with the plan of care and carrying that out per the medical record or per the provider's plan. So everything that I just assess here is something that you can be doing independently within your nurse's scope of practice. And I really appreciate you watching. If you like this video, give it a thumbs up, a like, and don't hesitate to subscribe for more content in the future. And for now, adios, goodbye.